Hi, my name is Richie Daniel and I'm a student physical therapist from Campbell University. Today we're going to be talking about the piriformis compression of the sciatic nerve special test. So before we talk about the special test, let's talk about the piriformis itself. The piriformis originates from the lateral aspect of the sacrum run from S2 to S4 and it inserts onto the superior aspect of the greater trochanter femur. So it runs along like this. And the functions of the piriformis is hip external rotation, hip abduction, and also a little bit of hip extension. So underneath the piriformis runs the sciatic nerve, and sometimes when this piriformis is on stretch, it compresses on the sciatic nerve. So the purpose of the test is to determine if the piriformis muscle is compressing the sciatic nerve against the greater sciatic notch, which is right there. So in order to stretch the muscle, we got to go from the opposite direction. So instead of going into external rotation, we want to go to internal rotation and then into adduction as well as hip flexion. So some of the symptoms that are associated with piriformis syndrome is persistent and radiating low back pain, chronic buttock pain, numbness, paresthesia, difficulty with walking, and other functional activities such as pain with sitting, squatting, standing, and even functional activities as bowel movements. The piriformis compression of the sciatic nerve can be reproduced by maximally stretching, as we talked about. And before we do the test, we want to make sure the patient is supine with both legs flat on the exam table. The clinician raises one leg and positions it in maximum flexion of hip and knee. The hip is then internally rotated and then fully adducted to cause a maximal stretch on the piriformis. Pain radiating down the leg constitutes a positive test for the piriformis syndrome. All right, so now Nate's going to be my patient, and we're going to start our test. All right, Nate, I'm going to have you lie down for me on your back.
Okay.
Excellent. So I know you had complaints of low back pain and radiating pain down to your leg, so I'm going to just perform the special test. And what it's going to do, it's going to, there's a muscle in the back of your butt called piriformis, and when that muscle stretches, it puts a lot of compression on this big nerve that runs on the back side of your leg. Okay? So I want you to try to reproduce those symptoms. All right? So what I'm going to do, I'm just going to raise his leg up. Okay? All right, now we're going to internally rotate the hip and adduct it maximally. And this should put a maximal stretch on the piriformis. Nate is a little bit more flexible than the average population, so you can put a little more adduction on him to get a bigger stretch. And if this caused any radiating symptoms down his leg, and that would constitute a positive test. Do you have any pain going down your leg at this moment?
I do not.
He does not, so the test would be negative.